one of the things that we've heard is this idea, again, this mindset, and I want to shift your mind. This mindset that let's do the gentle thing first in case it works and we don't need it. Let's be really gentle for the first cycle because I don't want to deal with the harsh side effects of chemo. Let's go with something gentle, and often that's a natural product. We talked about that separately. But just the mindset of starting gentle is not one that serves you. And I really want to hit this. For lack of a better metaphor, dipping into sci-fi here, think of your cancer, think of the tumor as the Borg. One of the features of the Borg, yes, they assimilate other things. And that's like cancer too. It spreads and it takes over. But one of the defining features of the Borg in Star Trek is that they adapt to attacks. They adapt rapidly. You hit them once and you do a bunch of damage, and then you try it again and you do very little, and the third time it does almost nothing. Your cancer may be like that. Many cancers are. Hello, and welcome to Elevating Cancer Treatment, where we explain the science and debunk myths to help you navigate your health journey. I'm Dr. Chaplin. An important reminder, I'm a PhD, not an MD. The information in this video is education, and it's not medical advice. Every cancer is unique, and no general information applies to everyone. If that sounds interesting, make sure to like this video, subscribe to the channel, and hit that notification bell so you never miss an update. And two quick things. First, as a thank you for being here, I've created a free resource, 10 Things to Elevate Your Chemo Journey, which you can download from the link below. And second, by signing up, you'll also get updates on that innovative cancer treatment I'm working on. Not all of them, but many of them, particularly the more aggressive ones. They have multiple features, extra chromosomal DNA. They've gone through chromothripsis. I know those are horrible terms. I'll go into those in separate episodes later. But they can adjust and adapt and evolve incredibly quickly. And so you actually run a really big risk being gentle up front. You want to do the opposite. Because if you come in gentle, then any cancer cells that survive have a chance to adapt and become resistant to that treatment, and then you have to switch to a different treatment, and then a different treatment, and then a different treatment. No one wants to deal with the side effects of chemo, and there will be side effects from chemo because it is harsh on your body. It's hard to target chemo, but you really want to have your first treatment cycles be as effective as possible. You want to go with the strongest regimen that you possibly can. If you are fighting the Borg, you want to eliminate them on the first hit. You don't want to take out half of them and then give them a chance to adapt. And that's what the mindset of let's be gentle does. It takes out some of the cancer, it takes out some of the tumor and gives it plenty of time to adapt. Whether the cancer can adapt fully during that time or not depends on the particular cancer. Every cancer is unique. Your story is going to be different from everyone else's. No two cancers are identical. No two cancers behave exactly the same way. So there are generalities, but no one can tell you what your journey will be like. However, if you go gentle and it doesn't get rid of 100% of the cancer in the first cycle, you've given it a chance to adapt. Maybe it will, maybe it won't. Some cancers adapt faster than others. Some are very slow to adapt. But do you want to take that chance? Is that a smart gamble? Do you want more pain, acute and short? Or do you want protracted pain that's not as intense, but for a much longer period of time? That's really what we're talking about. It's not side effects versus no side effects. It's if you go gentle with chemo, if you go gentle with your treatment, you might get lucky. If you don't get lucky, you set yourself up for a lot more suffering in the future. It's not a great trade-off. It really isn't. And that's something that I think most people don't factor into their mental calculations about what they want to go through. As your individual situation, we can't really say much without talking about the very specific instances of your treatment, your biomarkers, your particular cancer, what it expresses, what stage it's in, all of that very specific to you. There is a very big difference between what we call chemotherapy drugs, which hit all of the fast dividing cells in your body, versus targeted therapies, which are designed against specific features of a cancer. If you have treatment options for targeted therapies, go with those over chemo, and they are much more gentle. They are just as powerful, but they're much more gentle. Especially if you can add on to those immunotherapies or very targeted radiation, because those are actually tolerated really well in many cases. Beyond these videos, if you need more personalized guidance or a deeper dive into specific treatments to have your treatment be as effective as possible, I offer one-on-one sessions and medical advocacy. If you found this video informative, please give it a thumbs up, click the notification bell, and subscribe to our channel for more science-based cancer insights.